Here at the IMS, one of my colleagues, Dr. Rebecca Silberman from Oregon Health Science University, is presenting on behalf of the investigators of the master study the correlative analysis of immune reconstitution. Because the trial had serial MRD assessment by next-generation sequencing, as sort of a byproduct of MRD assessment, we get some information on the diversity of the immunoglobulin gene portfolio for both the heavy chain, also kappa and lambda. That allows us to describe the trajectory of expansion and contraction of their repertoire as patients go through therapy. And what we see is quite interesting. You know, patients at the end of induction and the end of 4 cycles of quadruple, they have a very contracted portfolio of diversity of heavy and light chain. Post-transplant, you have a quick expansion, and that tends to contract again with additional consolidation. That part is not at all surprising. But what we saw is that once you stop therapy, even though we can see in patients go on treatment on observation after treatment cessation, which over 80% of patients, 80 patients did on master, we see that you have a very slow recovery of immunoglobulin levels. Takes at least a year or so to have full recovery. But quite interesting, you have the recovery of the immunoglobulin repertoire happen much earlier. A lot of that recovery is already complete, is already stable at the end of 6 months. And quite interesting when you look at the rates of infection, it goes down tremendously once you stop therapy. So the message that we seem to learn from this is that even though the immunoglobulin levels may take a while to recover, you already have a lot of protection against severe infections by just having that quick expansion on repertoire. So more important than numbers, which is the immunoglobulin levels, is actually the diversity of your humoral immune response, which seems to recover a lot faster. And the reason why that is important, and we haven't had a lot of those data sets. We don't have a large cohort of patients treated with quadruple therapy who are able to cease therapy. And as we develop further the treatment of newly diagnosed myeloma patients, then we start to explore this approach of treatment cessation. It's going to be important to learn how this compares with other therapies that go beyond quadruple therapy in terms of immune reconstitution.